Today we will be talking about infection prevention and control, laboratory safety and waste management for clinics which provide antiretroviral therapy services. Learning objectives of today's talk: we understand the chain of infections. We'll learn hand washing steps, cough etiquettes, sharp safety, safe injection practices, sterilization and disinfection of patient care items and devices, environmental infection prevention and control, prevention of spread of pathogens and infections by using the current techniques for hand hygiene and universal precautions. We will also talk about how to protect ourselves and those around us by recognizing the chain of infections, how to identify, label, and dispose of hazardous wastes safely, and how to clean the facility. We will also talk about the guidance and supervision of cleaning and disinfection of facility. Each ART center must develop their own infection control program or preferably use the national guidelines to ensure the well-being of both patients and the staff. Salient components of the infection prevention and control program includes basic measures for infection control such as standard and additional precautions, education and training of healthcare workers, protection of healthcare workers by immunization and post-exposure prophylaxis, identification of hazards and minimizing the risks, routine practices which are essential for infection control such as aseptic techniques, use of single-use devices, reprocessing of the instruments and equipment, antibiotic usage, etc. Management of the blood and body fluid exposures, handling and use of blood and blood products, and management of medical waste. Each effective work practices and procedures such as environmental management practices including management of the clinical waste, support services like food and linen services, and use of therapeutic devices. Then there is incidence monitoring, which is very, very important, and outbreak investigation should always be conducted. There should be a surveillance mechanism and infection control in specific situations such as suspected cases of tuberculosis. Standard precautions are those precautions in which we treat all the patients in a healthcare facility with the same basic level of standard precautions, which involves work practices that are essential to provide a high level of protection to the patients, healthcare workers, as well as visitors. Standard precautions include hand washing and antisepsis, which means that hand hygiene should be appropriate, use of personal protective equipment when handling the body substances, excretion and secretions, appropriate handling of the patient care equipment and soiled linen, prevention of needle and sharp injuries, environmental cleaning and spills management, appropriate handling of the waste. Transmission-based precautions are also known as additional precautions, and which we take into consideration when we are suspecting tuberculosis, COVID-19, and other highly infectious conditions. These includes precautions that are taken while ensuring standard precautions are maintained. Additional precautions include airborne precautions, droplet precautions, and contact precautions. Droplet precautions are included in the additional precautions, which means that the droplet which are of the size more than 5 microns, we have to implement all the standard precautions. Wear a surgical mask when working within 1 to 2 meters of the patient. We have to place a surgical mask on the patient if transportation is necessary, as well as special handling of air is not required and special ventilation is also not required for the droplet transmission prevention. We have to adopt the contact precautions for diseases which are transmitted by the route, which include colonization or infection with multiple antibiotic-resistant organisms, enteric infections, as well as skin infections. Additional precautions include, for the first time, implement all the standard precautions, then wear the clean, non-sterile gloves when attending the patient, as well as wear a clean and non-sterile gown while attending. Now we will be talking about the principles of clean laboratory practices. So we have to treat all the specimens like blood, urine, sputum, as potentially infectious source. The worker has to wear the protective gloves and a lab gown while drawing the blood and handling the patient specimens. Do not eat or drink or smoke in the lab. Do not keep food in the lab refrigerator. Do not wear open-toe footwear in the lab. Clean up spills with an appropriate disinfectant using the right technique. Decontaminate all the instruments and materials with an appropriate disinfectant. Dispose of all the waste, including the test kits, in a biohazard container, which is properly labeled. Phlebotomy safety is a very crucial step, and injuries generally occur when we are drawing the blood or using a finger stick or heel prick to obtain the blood specimen or testing with the sharps. Whenever possible, we have to use the single-use vacuum blood container, we call it vacuum with safety needles rather than a syringe and a needle. Never recap or bend or break or manipulate the needles by hand. After the use of the sharp, put them in a puncture-resistant, leak-proof trash container and do not overfill more than 2/3 of the container. Centrifugation also leads to droplets which are in the environment, so always cover the centrifuge machine. It should be properly balanced and wait till the machine stops when the process is complete. Report all the injuries which involve sharps to the person in charge for the safety of the center. Post-exposure prophylaxis is the use of antiretroviral drugs to reduce the risk of HIV infection following accidental exposures to sharps. So P should always be available and try to inform the contact persons which are there for the safety as soon as possible. And post-exposure prophylaxis should be implemented within 72 hours. There are several types of hazards in the lab, which includes biological, chemical, electrical, and physical hazards. Biological hazards are the blood and the body fluids which harbor HIV, HBV, and HCV, as well as the organisms which may cause bioterrorism. Chemical exposures also occur, but generally in the labs where we are offering the HIV testing, we don't use any hazardous chemicals. Electrical hazards are always there, and this may be due to the master switches or there is short circuiting. So all the circuit breakers should be known and all the equipment must be properly grounded. Physical hazards include the fire. Fire safety is a must and fire drill should be regularly carried out, and how to use fire extinguisher should be known to everybody. Infectious agents in our environment include bacteria, viruses, parasites, prions, and fungus. All these constitute the infections, and the infections is spread by a chain of infection. That means that there should be an infectious agent, then there should be a reservoir or host reservoir, portal of exit, portal of entry, route of transmission, and susceptible host available so that the infection can be transmitted. Hand hygiene is one of the most important step that every healthcare worker should be using all the time. Appropriate hand hygiene can minimize the microorganisms acquisition on the hands during daily duties as well as when we are dealing with the blood and body fluids, body secretions, excretions, and known and unknown contamination of the equipment or surfaces. The doctor in charge will be responsible for provision of water and soap at all the patient's points of contact, and in the absence of water, the antiseptic lotions or solutions which can be used for hand hygiene. Hand washing has to be done after handling of any blood and body fluid secretions, excretion, or contaminated items, before and after contact with each patient, between the tasks and procedures on the same patient, to prevent cross-contamination between different body sites, and immediately after removing of the gloves. For hand hygiene, we either use soap and water as well as antiseptic agents. For hand washing, there are few steps which must be taken into consideration all the time. First of all, we have to rinse the hand, then use the soap, and then rub palm to palm, finger interplaces, and between back of the hands to the front of the hand, base of the thumb, fingernails, and wrist. Similarly, there are 5 steps of hand hygiene which needs to be implemented. Healthcare workers should always wash their hands when it is visibly soiled. Otherwise, they can use the hand rub by the steps that are shown in the diagrams. Each step must be strictly followed and a lot of practice is required. It should take about 20 to 30 seconds to do the hand rubs as shown in the picture. TB infection control is essential. There are 10 steps which are required for safety without stigma. That includes patients and community in advocacy campaigns. Adapt an infection control plan. Ensure that there is a safe sputum collection. Promote cough etiquettes and cough hygiene. Try TB suspects for the fast track. Assure that there is a rapid diagnosis and treatment initiation. Improve room air ventilation. Protect healthcare workers, capacity building, and monitoring of the infection control practices. Use of appropriate protective equipment is very, very essential, and all the care workers must be trained for appropriate use of protective equipment. This includes the gloves, protective eyewear such as goggles, masks, apron, gowns, shoe covers, and hair cover. Personal protective equipment must be available for use at all the times at the center. These personal protective equipment should not be shared between the individuals. Everyone has to change the personal protective equipment completely and thoroughly wash the hands each time a patient is being attended and when we are going for another patient's attendance. Personal protective equipment should be chosen according to the risk of exposure, and healthcare workers should assess whether they are at risk of exposure to blood, body fluids, excretion or secretions, and choose their items of personal protective equipment according to this risk. Avoid any contact between contaminated personal protective equipment and surfaces, clothing, or people outside the patient care area. Discard the used personal protective equipment in the appropriate disposal bags and dispose of as per the policy of the facility. Prevention of needle, stick, and sharp injuries is a very, very important precaution. So we have to take all the care that is required whenever we are handling the sharps. Never recap or bend needles. Please use disposable syringes and needles, scalpel blades, and other sharp items in a puncture-resistant container with the lid that can be closed. Such containers must be located in all the patient care and laboratory areas, and we have to take extra care when we are cleaning the sharps which are reusable. However, they must be avoided whenever it's possible, and sharp must be appropriately disinfected or destroyed as per the national guidelines. Management of healthcare waste is very, very important, and these include the site of generation, segregation and separation of the different types of wastes, collection, transportation, storage, treatment, and final disposal as per national guidelines. Next step is the segregation of the clinical or infectious waste from non-clinical waste in certain dedicated containers. These waste containers should be stored in specific areas with restricted access. Collect and store sharps in the sharp containers, and sharp containers should be made of plastic or metal that have a lid that can be closed. They should be marked with the appropriate label or logo that it's a biohazardous symbol or clinical infectious waste. Mark the storage areas with the biohazard symbol. Ensure that the carts or trolleys used for the transport of segregated waste collection are not used for any other purpose. They should be cleaned regularly. How to clean a spill? So wear the personal protective equipment correctly. Make sure that you have protected your eyes. You are wearing gloves and masks and apron. Open a leak-proof bag and turn the edges down. If a spill of blood and body fluid use chlorine concentration of 1 in 10,000 ppm. If spill is of vomit, feces, or urine and does not contain blood, then use chlorine concentration of 1 in 1000 ppm. Do not use the chlorine solution directly on urine. Always add tablets to water. Put absorbent paper over the spill, such as kitchen paper, towel roll, or old newspapers. Now apply the freshly prepared chlorine solution over the paper and leave the mixture for 5 to 10 minutes. Gently remove with the tongs and mixture of the spill and absorbent material and any broken glass and discard carefully in the leak-proof bags. Further, wipe the area with the tongs and fresh paper towels, always going from clean to dirty or from outside to inside of the spill area, and place it in the bag. Disinfection required in the healthcare facility has been classified into 3 levels. One is the high level disinfection, then there is intermediate level of disinfection and low level of disinfection. High level disinfection destroys all the microorganisms except some bacterial spores, while intermediate disinfection inactivates Mycobacterium tuberculosis, vegetative bacteria, most viruses, fungi, but does not always kill the bacterial spores. While the low-level disinfection can kill most of the bacteria, some viruses and some fungi, but cannot be relied upon to kill more resistant bacteria such as Mycobacterium tuberculosis or bacterial spores. There are 5 golden principles of disinfection, starting from soak, set, shine, standardize, and sustain. It's very easy to remember is 5S: sort, set, shine, standardize, and sustain. Now we will recap the key points that treat all the specimen like blood, urine, and sputum, and patient as a potential source of infection. So safety of staff, patients, and attendant is the responsibility of the ART staff. TB infection control at the ART center is a must and a very high priority to prevent transmission of TB between patients and the healthcare workers is required. Do not eat, drink, or smoke in the lab, and do not keep food in the lab refrigerators. After you use the sharps, put them in a puncture-resistant and leak-proof trash container right away. Do not place the sharps in regular containers. Appropriate hand hygiene can minimize microorganisms acquisition on the hands and during daily routines. And any contact with the blood, body fluids, secretions, and excretions, and known and unknown contaminated equipment and surfaces should be avoided. Hand washing is a must after handling any blood, body fluids, secretions, excretion, and contaminated items, as well as before and after each contact with the patient, between the tasks and between the procedures, either on the same patient or a different patient. Cross-contamination between different body sites has to be avoided at all the times. Thank you very much for your patient listening of all the precautions. I hope you will adopt all them in your daily practice.